Yes, I will be talking about nutrition in liver disease and transplant. Next slide. So a few of the objectives that I hope to really instill today are just taking a look at what normal nutrition looks like in children that are in a healthy state, and then versus nutrition needs of those children with liver disease. We'll look at causes of malnutrition and why that is a big important factor, discuss types of nutrition support that may be necessary, and then lastly, review food safety guidelines for post-transplant. Next slide. So before getting into specifics about nutrition and liver disease, I just wanted to take a quick moment to talk about nutrition in general and why it is important. Next slide. So one of the biggest things that we think about when we think of children and nutrition is that we need it for growth. So unlike adults who just require adequate nutrition to make sure that they maintain normal body function, children require adequate nutrition for that purpose, as well as making sure that they are developing appropriately and having normal growth. Because without proper nutrition, we can see issues with stunting or significant weight loss, as well as developmental issues. So for instance, if we're not giving enough calcium, we can see weak bones, or if we're not giving enough essential fatty acids, we can see some issues with brain development. And then lastly, providing healthy nutrition habits early on in life can help prevent potential health issues in the future, such as obesity and diabetes, just to name a few. Next slide, please. So I know this slide is a little bit overwhelming with all of the numbers, but I just wanted to kind of show from a dietitian perspective how we're estimating children's needs. So looking at calories, protein, and fluid. And although these are a great place to start and they are averages, we know that it's not a one size fits all for every child. So really making sure that we're monitoring growth all of the time, and then taking into account if we need to add a little bit more nutrition or a little bit less, just to make sure that we continue appropriate growth throughout the life. Next slide, please. Okay, so now we'll get into nutrition and liver disease. Next slide. So one of the biggest concerns that we have from a dietitian perspective is the increased risk these children have for malnutrition. And malnutrition can mean either they're undernourished, it can also mean that they're overnourished. For this talk will focus on children who are undernourished, as that is what is most common in this population. And so while malnutrition is concerning as a whole in general, it becomes a little bit more concerning when maybe liver disease has progressed to a point where they're going to require a transplant, just because studies have shown that poor growth prior to transplant or being malnourished leads to poor outcomes after transplant. Like I also mentioned earlier, they need more calories, more protein than adults to make sure that they're growing appropriately. And specifically in this population, they have increased needs on top of that as well. And then lastly, kind of looking at more of a post-transplant issue, refeeding syndrome can be a big concern. If you think of going into transplant with a poor nutrition status and then coming out of transplant, and we're really trying to push calories and nutrition to try and catch up, we can get in a dangerous place of those electrolyte shifts that could potentially be fatal if not taken care of. And so really trying to optimize nutrition prior to transplant is our biggest concern. Next slide, please. So assessing for malnutrition in this population can be quite tricky. Most of the time, weight gain is not quite accurate, and that might be because these children accumulate a lot of fluid, they have those large bellies. And so even if we see weight go up, we are initially thinking it's probably fluid related and they likely still need more calories. And so a way that we can double check this, so to say, is to take what's called a mid-upper arm circumference. And that is a little bit more accurate just because we want to look at lean body and fat mass, and the area of the upper arm is less sensitive to fluid shifts. And so I just kind of wanted to give an example here. This picture shows a little boy or girl getting their mid-upper arm taken. And then this growth chart behind, I wanted to give an example. This patient that I saw initially was receiving a significant amount of calories, 200 calories per kilo. And just to put that into perspective, a child of the same age without liver disease would estimate to need about 80 to 100 calories per kilo. So almost double what a normal child would need. And they were drinking a significant amount of formula, up to 56 ounces per day. And although we see the weight kind of trending up right there, it was mostly fluid related. And we double checked that with taking a mid-upper arm. And we saw that his Z-score was very low. So if we have a Z-score of -3 or greater, that indicates severe malnutrition. So despite pushing calories orally and via tube feeds, ultimately we had to start this patient on TPN, and I will talk about that a little bit more later. Next slide, please. And so we've been talking about malnutrition and how patients with liver disease are at a higher risk for this, but why are they at higher risk? And so one reason is because they have increased metabolic activity that requires higher energy needs. Again, like I showed in that last slide, they could need up to 2 times what a normal child needs. But it can be really difficult to get them those increased needs because they may have a poor appetite and intake. This could be due to reduced gastric capacity. Either they have a lot of fluid accumulation or they have an enlarged organ, which leads to them feeling full earlier, so not being able to take in as many calories. They may also have oral aversion. We see this a lot in kids who require tube feeds, who have gotten nutrition from other aspects aside from eating. And so that can put them at a developmental delay as well for kind of keeping up with what they're taking orally. And sometimes these kids are on formulas that don't taste the best. And so if they don't like the taste, then they have a decreased desire to eat as well. And then lastly, some of these kids may be suffering with nausea and vomiting, and nobody likes to eat when you feel like that. So that's an issue. And then lastly, these children have trouble with absorbing and digesting and absorbing foods properly. And also they have increased nutrient loss from, again, vomiting, having increased stool output. And so not being able to absorb all of these calories that we're giving them kind of is like a vicious cycle of what leads to malnutrition. Next slide, please. One more. So kind of going off being unable to utilize nutrients properly, I wanted to look at macronutrients. And so this consists of the carbohydrates, protein, and fat that we have in our diets. And so looking at carbohydrates, some of these kids are at risk for low blood sugars, and that's just because glycogen storage is depleted with liver disease. And so sometimes they may require constant nutrition to make sure that their blood sugars aren't dropping. And doctors may have you check your child's blood sugar at home as well, just to make sure we know we're giving them adequate nutrition. Protein breakdown is also increased, which can lead to toxic waste buildup, such as ammonia, and then which can lead to encephalopathy. And fat is really hard to digest in these patients. This is probably the biggest macronutrient concern. And so a lot of the time we will require formulas that are a little bit broken down and have higher MCT content, like this formula on the slide here, progestamil is a very common one that we use. MCT is a lot easier to digest and absorb than other fats. And so that's a good way to try and give a little bit more calories more easily. However, they don't have those essential fatty acids that we require for development and growth. And so we worry about essential fatty acid deficiency, which is another cause of poor growth. And then if we don't have those essential fatty acids, thinking back to the issue with poor brain development. Next slide, please. Okay, and it's a little bit more difficult to see the impact micronutrient deficiencies have on our bodies compared to macronutrient deficiencies. If you think about if you're not getting enough carbs and protein and fat, you see weight loss. But if you're not taking in enough vitamins, it's really hard to see an immediate impact. But they are very important. And while all vitamins are important, in this population specifically, we're going to look at A, D, E, and K. They're known as fat-soluble vitamins. And so because children have a harder time absorbing fat, they have a harder time absorbing these nutrients as well. And I won't go through all of the details here, but making sure that we are promoting foods that have high sources of these or high levels of these vitamins is important, but oftentimes they will require additional help through supplementation with vitamins like Aquadex or Deca, just to make sure that we're really packing in those nutrients to make sure that we can maintain those levels and avoid any adverse effects from deficiencies. Next slide, please. Okay, so sort of like I had alluded to before, some of these children will not be able to maintain proper growth on oral nutrition alone. And so very often they require some sort of nutrition support. And during the pre-transplant evaluation period, I always like to kind of give parents a heads up just so that they're not kind of blindsided by this if it is needed, but it's not uncommon for children to require tube feeds to help them grow. And I like to also tell families it's not permanent. It's just something to help get us in a better nutrition state. That way we're in a better state after transplant as well. Typically they'll have what's called an NG tube, and it just goes right in your nose and down to your stomach. And that is the preferred route just because it's easy to remove, it's less permanent. And then type of formula is also very important. I had shown progestamil before, and that's one that, again, we typically use. Just because we're giving tube feeds doesn't mean that they can absorb other formulas better. So really making sure that we're looking into that formula that's going to help them grow the best. And then looking at bolus versus cycled versus continuous feeds. We like to try and do bolus feeds because it's more similar to like meal times at home. And so it makes that quality of life better. And sometimes that will be paired with tube feeds cycled overnight. That way during the day, they can be off of tube feeds. But oftentimes to be able to give the proper nutrition that we need and to, again, ensure that blood sugars aren't dropping, we often require tube feeds to be given continuously. And then if we continue to see poor growth on enteral nutrition and oral intake, a child may require TPN. This is our last option just because it has a higher increase or an increased risk of infection just because you have a central line. But children do grow very well on TPN. And so they won't be on it for too long, just to, again, optimize nutrition to get them through transplant. Next slide, please. Okay, so once we get through transplant, I wanted to talk about what looks different nutritionally. Next slide, please. And I apologize, this image is a little bit blurry, but I did like how it showed the difference between nutrition needs before transplant and then after transplant. So kind of like we've already discussed, before, they need a greater amount of calories and protein to support normal growth. And afterwards, because their liver is functioning properly, they don't need quite as many calories. But we don't want to just immediately drop to what the average would be. We want to go slowly to make sure that we're still maintaining proper growth. And we don't need to push as many calories, kind of like we had before. And so although the child has gone through liver transplant, there's still a possibility to damage this new organ. And so kind of like Dr. Mavis talked about earlier, that can include fat buildup. And so making sure that we're educating on an overall healthy diet, which includes multiple servings of fruits and vegetables, lean proteins, whole grains, and then limiting those sugary foods and beverages, and increasing physical activity if possible to make sure that we are preserving the health of our new organ and then just overall health in general. Next slide, please. And the biggest thing that I talk with parents about prior or post-transplant prior to going home is food safety. Next slide, please. And so this is just a fun little slide with different images to kind of help you remember some of those important things. So first of all, making sure that we're not eating foods that look moldy or are expired, or maybe at the grocery store, the cans are dented, anything like that. We want to avoid that at all costs. Also wanting to make sure that when we're preparing foods that raw meats and then vegetables or fruits or fresh foods are prepared separately. That way we avoid cross-contamination with raw meats. Making sure that we're cooking foods to a proper temperature is important, and then chilling them so that bacteria don't grow. Washing our hands and just having proper hygiene. Making sure that milks and cheeses and fruit juices as well are pasteurized. It's an extra process that they go through to make sure all of the bacteria are killed off. Thinking about things such as buffets, or if you're going to a party and people are able to serve themselves, just being extra cautious in that scenario because we don't know who has touched what and if they have practiced proper hygiene. Making sure that our water sources are clean. And then lastly, just really telling patients, the only one thing that you can't have is grapefruit, and they're usually very on top of that. Next slide, please. And so this is sort of the same concept, just written out. So things to avoid, and then just some important tips to remember. Next slide, please. And then these are really great resources that I will provide families with. And so I wanted to kind of link them here as well. This one on the left, the food safety handout, kind of goes through everything we briefly touched on. And I like that families can have something physical to take home with them that they can reference once they're out of the hospital if they forgot to ask a question. And then this Food Keeper app is really helpful too. You can look at, how long can I keep a food? What temperature should I keep it at? And so just, again, being extra cautious that the foods that we're eating are not contaminated. Next slide. And that is it.